That's a whole bunch of different things that you just brought up, and it does sound like a big job. I'm wondering, for your neighbors in your neighborhood, for the people that you live next to, when they walk down the street and see a Barbara Baier for county commissioner sign in the yard, what does that mean to them? Living in the city, living in one of our core neighborhoods, or the core neighborhood as it's been referred to, what does it mean to them having you as a candidate?
Well, I think it's really valuable to know that presently, of the 5 commissioners that we have, there is no one from established core neighborhoods there to represent those needs and interests. And since I do live near the Capitol, which is an area of town that's gotten a lot of press lately, I think it's really important to understand the relationship the county board has to those neighborhoods. For instance, community mental health services are funded through the county board, and we have a very good community mental health services center, but all the needs for people with mental health issues, chronic, serious mental health issues, are clearly not addressed, particularly if you live in the neighborhoods in the established parts of the city. You realize that a lot of people are going in and out of our county jail. Upwards of 30%, 40% of the people who go to the county jail, in and out all the time, are people that are underserved regarding their mental health issues. And there are opportunities that the state of Nebraska has been offering to the county board, close to $1 million, to go and help fund community services for the chronically mentally ill that are often going to the county jail. But the present board doesn't see the need to take those monies, accept those monies, and create the kind of, or expand the kind of programming that is needed to address that issue. And I think therein is one way we could reduce the overcrowding that exists in the county jail, and will continue to be a problem regardless if we build a new jail or not. We have to address who is going and using that facility the most, and too often is people with chronic mental health issues. They need services. So that is an issue that I think that people in established neighborhoods should realize the county board really impacts them.
What is the impact on an established neighborhood when somebody who needs mental health services does not receive adequate services?
Well, it can be expressed in many different ways. Sometimes you get properties a result from this. People may have a hoarding problem. People don't realize that when people gather junk around their house and everything and keep doing that, that's actually a mental health issue. Well, another one is that sometimes people engage in things like substance abuse or alcohol abuse, and that very frequently, not always, but very often, that's people going and self-medicating for an unaddressed mental health issue. They can't access the services they need, or maybe they have and they're not getting the kinds of medications that they need on a regular basis, or they don't have enough support to help them take those medications. And so then they go into various different states of mental illness, and they may be doing things that they don't even realize they're doing, that maybe if they were on their medication, they were getting help, they would never throw that brick through the convenience store to get the cigarettes, because they'd realize that's not a good thing to do. But when you're having real issues and they're not being addressed, you become a burden to your neighbors and your community. And it's really sad, because in this day and age, with the kinds of medications we have, the kind of expertise we have in the field of psychology and psychiatric care, we can do things that are very successful with people with mental health issues, and it's a matter of making sure those community services are there.
Kind of a related question, and also referring to something you said at the beginning of our show about the board, about the county commissioners and their role with human services. In light of the fact that over the last few months, the city has kind of sent a message that they will not fund, they want to get out of the business of funding direct human services. How does that impact the county commissioners in terms of that balance between city and county and human services?
Well, I know that there's some parts of our community that are really advocating very forcefully for local government to do no unmandated human services. And that means that if the state or the federal government has not specifically said in law, you have to do this, that there is a desire not to do that. And I think that that is very short-sighted. And part of the reason is that we have traditionally, since the inception and before of this country, looked at the county level, or what in times past we called the parish, for services, for relief when there was homelessness, for help with our elderly, for help with people with mental health issues. We've traditionally looked at county government, at local government, as the entity that is going to go and help us get through these issues and bring stability to our families and then our community. And by not going and having the foresight of funding these, sometimes they cannot be done by nonprofits. I've worked in the nonprofit field. Nonprofits struggle mightily to be able to go and get every dollar that is usually donated to be able to do their services. And some issues are so huge in the community, such as homelessness or mental health issues or substance abuse, that nonprofits alone cannot do that. What's needed is a partnership between local government and nonprofits, and quite often the faith-based community, to be able to effectively address these issues. So I think it's important that we have that realization in local government, and we have a voice on the county board that says, yes, we don't want to fund every service that comes along, but there are times when it makes logical sense. It's more cost effective for everybody that we go and we have those partnerships with nonprofits in the faith-based community.